Welcome to our Freedom from Suffering Now blog. I'm Dr. Steve Grinstead. Today I want to start with telling you a little bit of a story. The story is that many years ago, I learned a lesson at 12 years old about how when I get hurt, I just want the pain to stop and I'm willing to do anything to make that stop. I'm wondering if anybody's been there. You know, it was an injury. I got rushed to the emergency room, got it taken care of, and then I learned another lesson. I learned that not only did I want my physical pain to stop, I wanted my emotional pain to stop, and some of these medications I was given did that. Now that led me up to a very interesting time for the next 18 years of trying to find ways to stop my pain. Usually alcohol and pain pills. I wanted the pain to stop. You ever been there? You know, many of the people I work with who live with chronic pain often experience coexisting problems because of living with a chronic pain. Depression, anxiety, sleep, even addiction or abusing their pain meds. So today, I want to talk about a way out of that. And it's not for everybody, nothing is. But before I talk about this, I just want to share one thing. I don't think that symptom management is enough for chronic pain management. So this is not about symptom management. This is about finding another tool in the toolbox for increasing people's quality of life and level of functioning. And that can be done with a medication called buprenorphine. Now, buprenorphine is the active ingredient in an opiate addiction-assisted medication called Suboxone. The Suboxone also has naloxone in it, which makes it much more difficult and challenging to abuse. Now this, again, isn't for anybody, but you know, many people who have been on opioid medications for a long period of time, 6 months, a year, 5 years, 10 years, they can develop a condition called opioid-induced hyperalgesia. Some people call it pain rebound. What happens is, to put it quite simply, is the medication is causing some of the symptoms that you're taking the medication to manage. Now, why do I think buprenorphine is a good alternative? Well, it's different than most opiates. It's what we call a partial agonist or an agonist-antagonist type medication. And many times it's used as a transitional medication. Now, for people with really difficult chronic pain that doesn't respond to different modalities, that buprenorphine might be an alternative. But you got to get off the other opiates first. There's also a new product out for the last several years. It's a patch delivery system that's a 7-day patch delivery system, Bupatch, buprenorphine, that's time delayed and doled out over a period of a week. Much more challenging to abuse. Now, if you're watching this video on YouTube, please take this opportunity to go to the Freedom from Suffering Now blog at the link below. And if you or someone you love is suffering with chronic pain and has coexisting problems, this is your opportunity to also check out my book, Managing Pain and Coexisting Disorders. And it's based on the addiction-free pain management system. This is for people who have chronic pain and coexisting problems. It's helped many people, so don't put it off. Check it out today. Get the book. Read the blog. There's also a value added. I've just posted a new in-depth article on Suboxone and buprenorphine. So in addition to the short blog you're going to see today, if you go to the link at the end of the blog, you'll see my brand new article on this topic because I believe it is so important. You know, freedom from suffering is everyone's right, and it's also a responsibility. I know how important it was for me when I was in that deep, dark, chronic pain trance to where I needed to find alternatives. And it doesn't always need to be medication. And it might not be Suboxone. It might not be buprenorphine. It might be something else entirely. It might be acupuncture. It might be chiropractic. It might be physical therapy. It might be restorative yoga. There's many different things that can help. I just want you to get some help today. It's really important to take action, so please don't put it off. Go to the links below and learn more about how to take your life back, stop suffering with pain, and improve your quality of life. Thank you for being here, and please check back frequently.